stress syndrome is a life-threatening lung condition that can occur directly or indirectly. Let's break it down. The lungs are composed of alveoli sacs that are responsible for gas exchange. They're surrounded by capillary membranes which prevent liquid from entering the sacs. With ARDS, we see a leaking from this membrane into the sac. The sac will collapse, hypoxemia occurs, and organs suffer. Patients will start in the exudative phase. The fluid that leaks into the sac is protein-rich. Remember that water follows protein, so we'll see pulmonary edema and a whole list of trickling effects. Big key is the formation of a thick membrane, which causes the lungs to be less elastic and compliant. Hallmark sign in this phase is refractory hypoxemia, where OSAT does not improve with supplemental oxygen. We then move to the proliferative phase, where the lungs try to repair the damage done but are actually hurting more than helping. They patch the damage with dense tissue, making the lungs even harder to expand. And last, the fibrotic stage, where the lungs become fibrotic due to major lung damage. Early signs are barely noticeable, which is why ARDS can turn bad quickly and progress to these late signs. Biggest treatment is mechanical ventilation called PEEP. Think positive for adding pressure into the lungs to prevent them from collapsing after each breath, but we want to watch for these complications.